Take a guess. How many studies exist examining the effectiveness of addiction programs for pornography viewing? The answer? 0. Pretty shocking, right? Addiction programs like AA have been around for decades. These have been helpful for countless of individuals over the years, overcoming drug and alcohol problems. Many have attempted to apply the addiction model to sexual concerns, like unwanted pornography viewing. However, research does not support the idea that classifying pornography as an addiction is helpful. In fact, it may even be part of the problem. Several researchers have found that individuals who are religious are more likely to perceive themselves as addicted to pornography, even though they're not viewing it at higher rates than less religious individuals. Importantly, people who perceive themselves as addicted may even view pornography at higher rates. Let that sink in for a moment. Believing you're addicted to porn may actually increase your unwanted pornography viewing. Additionally, researchers have found that moral disapproval of pornography was related to both religiosity and perceived addiction. Basically, if you think pornography is bad and are religious, you may be more likely to get stuck in the "I'm a porn addict and I can't stop" trap without being able to find a way out. You feel guilty about your viewing, believe it's morally wrong, and yet can't stop because viewing porn is what helps you cope with the feelings of guilt and shame about, well, viewing porn. So what is the answer? If the addiction model does not adequately explain unwanted pornography viewing, what does? The answer? Compulsivity. This is how compulsive behaviors work. We experience a negative emotion such as stress, anxiety, guilt, loneliness, or shame, then engage in a behavior to reduce the negative feeling by viewing porn, masturbating, eating, shopping, gaming, etc., which helps us feel better temporarily, but then leads to more feelings of guilt or shame. In order to cope with these new feelings, we return to the behavior that worked in the first place, but also kind of caused the problem. We view more pornography, masturbate, shop, eat, game, etc. again and again and again. That's how compulsive pornography viewing works. Viewing porn helps you feel better temporarily, but worse in the long run, because you feel ashamed of yourself for viewing porn. It's not just something bad you're doing. Shame makes you feel like you are bad. As a researcher and therapist, I have an ethical obligation to offer treatments that work. There are only 2. That's right, 2 total published studies investigating any therapy for reducing pornography viewing. Both studies found acceptance and commitment therapy, or ACT, to be an effective treatment in reducing porn. ACT has been around since the 1980s. Research has supported its effectiveness in treating many disorders, including depression, PTSD, chronic pain, and anxiety. Importantly, ACT has already been found effective in treating other compulsive disorders, such as OCD. If unwanted pornography viewing functioned more like a compulsion than an addiction, it made sense that ACT would be effective, and it was. In 2010, researchers Dr. Michael Tuig and Jesse Crosby from Utah State University published their first study examining the effectiveness of ACT with 6 adult males who reported problems with unwanted porn viewing. After 8 90-minute sessions, participants were able to reduce their viewing by 85%. 3 months later, these men continued to show, on average, an 83% reduction in their porn viewing. In 2016, these same researchers, Dr. Jesse Crosby, now at McLean Hospital, Harvard Medical School, and Dr. Michael Tuig, recruited 28 adult males who were randomly assigned to 12 sessions of ACT or a waitlist control condition. The results of their second study were even more convincing. 93% reduction in porn viewing in the ACT condition compared to only 21% reduction in viewing in the waitlist condition. After 3 months, participants continued to demonstrate an 86% reduction in porn viewing. Over half of the participants reported no longer viewing porn at all. At 3-month follow-up, over a third of participants no longer viewed pornography at all. ACT is the only therapy with published research regarding its effectiveness in reducing pornography viewing. This is exciting news. If you've tried other addiction programs and found they didn't work, don't give up. The reason these programs didn't work for you may say a lot more about the addiction model being a poor fit for treating unwanted pornography viewing than your ability to overcome a compulsive behavior.